Modern life. Between careers, kids, and health, it can be mayhem. That's why we're here. I'm Dr. Lisa Varghese-Kroll.
And I'm Dr. Lonray Falusi. We're physicians, moms, and longtime friends who break it all down for you. Wondering how to juggle all the balls and still stay sane? Looking for advice but don't want to be overwhelmed?
Curious about how to make the most out of life for your family but enjoy it at the same time? You're in the right place. Welcome to Health and Home with the Hippocratic hosts.
On this episode, we're talking about anxiety in children. How has the pandemic impacted the mental health of children? How can you identify when anxiety is troubling a child in your life? And what can we all do to help kids and teens who are experiencing anxiety? Hey, Lise.
Hey, Lon, what's new?
Well, we're still in a pandemic, so nothing is new and everything is new.
I hear that. As you and I have mentioned several times this season, we are 2 years into this pandemic. Unbelievably. So life kind of feels like a broken record in some ways, but in other ways, we're still dealing with the uncertainty about the future, constant change in COVID guidelines, wondering if we're making all the right choices around masking in schools and social gatherings.
And for parents of kids under 5, there's the yo-yo of COVID vaccines for that age group, right? There's that sudden glimmer of hope in mid-February that the vaccine was right around the corner, followed closely by deep disappointment. It's just been so up and
crushing
down.
Despair.
Right.
Right. And when it comes to kids, they've really been left out of the conversation about mental health, haven't they? Like a lot of attention has been paid to the epidemic of anxiety and mental health disorders that have affected adults during this pandemic.
Yeah.
But unfortunately, they've affected our children as well. Now, thankfully, more recently, there has been a little bit more in the national press calling attention to the mental health crisis that our children are facing.
Yes, very true. In fact, last fall, in October 2021, 3 major pediatric organizations, the American Academy of Pediatrics, the American Academy of Child and Adolescent Psychiatry, and the Children's Hospital Association, declared a national emergency in children's mental health. So they did.
Serious.
Yeah, it really is. It's really a crisis. So they detailed the serious toll that the COVID-19 pandemic has had on children's mental health on top of already existing challenges. So we'll link to that announcement in our show notes on hippocratichost.com. And it's a great place, I think, to start for understanding where things with kids' mental health are right now.
The fact is there's just so much happening in the world that can make kids and teens feel anxious. So for that reason, we're so fortunate to have an expert on childhood anxiety here with us today. Dr. Lisa Fortuna is a highly experienced child and adolescent psychiatrist and the chief of psychiatry and vice chair at Zuckerberg San Francisco General Hospital of the University of California, San Francisco, or UCSF. She's the principal investigator of a large multi-site research trial called Kids Face Fears, which is focused on the treatment of child anxiety. And her areas of expertise are child and adolescent psychiatry, treatment and research on PTSD across the lifespan, immigrant mental health, access to care, and implementation research, including digital interventions. So welcome, Dr. Fortuna.
So let's start by defining anxiety. What is it and how common is it?
Okay, so anxiety is an interesting thing because most of us experience it at some point or the other, right? But when we're thinking about, right? We're always anxious, and sometimes sometimes anxiety can help us, right? Sort of have a little bit of energy around doing something. But when we're thinking about anxiety that's troublesome, really what we're talking about is anxiety that are anxious feelings, fears, and even physical symptoms like, sort of feeling jittery in your, stomach or fast heart rate that you can feel it in different circumstances. And I think when we get concerned for children or for anyone is when that anxiety and those fears, those worries, those physical symptoms start to cause them distress or get in the way of things that they would normally do, right? And that is developmentally appropriate, like school or being with friends. And what we have is different disorders that we put under the umbrella of anxiety. And they really relate to the things that could make a child anxious or an adolescent anxious. So social anxiety, feeling very fearful in social situations, or school anxiety, right? Where, they're having a hard time going to school because they feel anxious about either the social piece or the performance piece. Or so really it's contextual.
Mhm.
And it's really how much does it impair the person or not, is when we think about, is this a problem?
That is such a good point, in that there's anxiety that we all experience, and in some ways it's actually helpful and
Right.
protective almost. But when we tip into anxiety disorders is when we
Hmm.
become more concerned around, functioning and all of that. And is it pretty common in children, anxiety disorders, I guess that is?
Yeah. So I mean, what we know from data, and some of this is pre-pandemic, right? So we'll talk a little
Mhm.
bit about how the pandemic may have exacerbated or worsened some of this, but a lot of the CDC data and public health data put anxiety disorders amongst children around sort of the 9% to 10% range. So it's
Mm.
not uncommon. I mean, if you
Mm-hmm.
think about that,
Mhm.
that's close to 6 million, children who might be
Mm-hmm.
experiencing an anxiety disorder that's enough to impair something in their functioning or development. So it's quite significant, and it's actually more common than depression,
Hmm.
which might be closer to 4 to 5% of the
Mm-hmm.
population usually.
That's interesting because I think, the population that we often don't talk about when it comes to mental health is children. And you talked a little bit about the physical manifestations of anxiety in kids. Are there similarities or differences from how adults manifest anxiety?
Yeah. So, I mean, there are things that children can experience that are more typical of what we think are
Mhm.
anxiety, right? Sort of, I'm worrying, worrying a lot, feeling fearful or scared.
Mhm.
But for children, especially younger children, the way that it can present is a lot more of the physical symptoms,
Mm.
where they might sort of just say, I have a lot of stomach aches, or my head hurts, or I feel bad in my stomach,
Mhm.
even having problems with bedwetting, not wanting to eat, because not
Mhm.
feeling well. Maybe, and maybe some more vague symptoms of just feeling, jittery and not well. And sometimes that's the way that it can present in younger children. Or also, notice, a parent might notice that they are avoiding things. And avoidance
Mm.
is something that is a word that often is associated with anxiety. Like if they're
Mhm.
avoiding being around people, for example, is it reaching a social anxiety, or avoiding going to school, becoming tearful about going to school? Those kinds of avoiding and not wanting to do things might be a sign of anxious feelings about that thing or person
Mhm.
or situation.
That's really good for parents to know,
Yeah.
because otherwise that could be easy to miss during the
Mhm.
hustle and bustle of daily life. Do you
Yes.
see differences in how children manifest anxiety throughout the course of childhood? Like, does a toddler versus a school age child versus a teenager tend
Hmm.
to display these symptoms differently?
Yeah. So, I mean, when you're getting to the younger children, right, like the toddlers, we might,
Hmm.
notice a little bit more of what I was talking about in terms of the physical symptoms. And there's just
Hmm.
sort of this vague avoidance and irritability and tearfulness, right, about situations. That might be more of the presentation, because if you think about toddlers, really, they're starting to explore the world and trying things out and kind of moving away from parent, and and then coming back, right,
Hmm.
to sort of get comfort and support. But when they really become overly anxious or tearful or avoidant about exploring or experimenting with things, then that might be a sign of some anxiety in a toddler that is at least worth exploring with the pediatrician, right?
Hmm.
Usually is where I think that would come into attention. And then as they get more into school age, older school age children and adolescents, I think we start seeing a little bit more of what we think is classic anxiety, right?
Mm.
Because as kids get older, they might be able to more express, well, I'm having a lot of negative, anxious thoughts or
Mm-hmm.
worries, right? Like they can express a little bit more of that cognitive piece of anxiety,
Hmm.
right? That I'm
Mm-hmm.
worried that this is going to happen, or I'm scared about
Right.
this, or I'm
Mm-hmm.
feeling horrible in front of my friends or peers, and I just get too anxious. And they can kind of connect a little bit more. that sort of physical anxious feelings to those thoughts, right? Like they can sort of more clearly
Mm-hmm.
say, when I get in front of the classroom, I start sweating and I start feeling jittery and almost like I'm going to faint. And I start thinking everyone's thinking I'm a fool and I'm stupid. They can sort of
Mm-hmm.
articulate those connections
Mm-hmm.
a little bit more as kids get more verbal and more insightful about what they're
Yeah.
experiencing and being able to articulate it.
And you started talking about avoidance of certain things that might cause anxiety for
Mm-hmm.
kids. What are some of the more common causes of anxiety in children?
Yeah. So, I mean, the causes are interesting, right? I mean, we know that there's some children that might just be more predisposed genetically to anxiety disorders. The anxiety disorders can run in families, right? But there's also sort of experiences and modeling, right, of how to manage stressful situations. So, young people who have been exposed to a lot of stressful experiences, and that could be anything from bullying to situations where they felt like they were not safe or under, having control over situations or circumstances. I mean, those might be real situations where, you might develop anxiety. And in some ways, you think it's reasonable, right? That you experience
Mm-hmm.
something very stressful and you start
Sure.
becoming avoidant and reactive to it. I think what becomes problematic is when it generalizes, right, to situations that are
Mm-hmm.
not as threatening.
Mm-hmm.
And it just continues. And that's why also post-traumatic stress disorder is an area of diagnosis that tended to fall under anxiety
Mm-hmm.
disorders. We're thinking about them more in particular because we can think of a direct trauma, right, that has
Sure.
resulted in this anxiety and worry and avoidance and reactivity, right?
Mm-hmm.
But it could be milder things for other anxiety disorders, like bad social situations, or feeling bullied or judged,
Mm-hmm.
and or not feeling like you do well in school and feeling very negative about yourself and having performance anxiety because of that. So I think all of those things can perpetuate sort of a risk for anxiety. And sometimes there's real threats in the world, right? And I think that's really where anxiety, the care and treatment is sort of what are the real threats or situations where anxiety protects us, right? And
Mm-hmm.
what are situations where the threat's not there, right? And how can we look at that situation differently and explore the world without feeling like everything is threatening or scary?
You know, one of those real world threats is COVID, 2
Yeah.
years into this pandemic. And have you seen changes in terms of pediatric anxiety since the pandemic began? Have you seen more kids showing up at your office, or are they expressing anxiety differently? What have you
hmm
noticed?
hmm So we have definitely seen an increase in anxiety presentation. And the interesting thing is that what we're seeing clinically and also in national data is that adults, the caregivers, have extreme anxiety, right, during the
Right? Yeah.
pandemic, right? So there was a national study that showed that they surveyed people, and 52% of this sort of nationally representative sample said adults were saying their caregivers and they're experiencing like significant
Wow.
anxiety throughout the
Absolutely.
pandemic. So if we think about it as, pediatric caregivers or parents, when we're anxious, right, as adults, we know that that makes children anxious, right? And
Sure.
that's really, because they look at us, right, and they can pick up,
Mm-hmm.
that we're worried, that we might feel like there's a threat, and they look, children look to their parents and caregivers to see, is there something scary here, right?
Mm-hmm.
Mhm.
So that has contributed to anxiety, I think, in children as well. And COVID was very scary, and I think there's populations that we serve, at least in our clinic, who were at high risk, especially
Mhm.
early in the pandemic.
Mm-hmm.
The children of essential workers, children of medical providers, right? People who
Mm-hmm.
have to be out in the world, who are at risk, and so children being very scared of their parents having COVID and becoming ill and dying, or they were very scared, the children themselves, of catching it as well and not knowing what would happen to them. And it, just the fact that everyone was so anxious and there was a lot of risk prevention and everything else kind of highlighted for children that this can be very scary. And then also, I think kids lost a lot of their structure and support
Yes.
system.
So
Mhm.
true.
So you're in the house, you're lonely, maybe you're online talking to other anxious kids, you know what I mean? And, bored
Mhm.
kids or trying to figure out what to do, or you don't have the structure, the support of your teachers. A lot of children rely on their counselors, their mental health providers that they see in school, their coach, who kind of helps them through things.
Mhm.
And sort of
Right.
losing that, all of those things contributed to, I think, an increase in anxiety. And so that's where we saw a lot more presentation of kids really understandably and reasonably worried about the world,
Mhm.
and what was happening with COVID, and not knowing really, what to think about that. And their parents
Mhm.
anxious too.
Mhm.
But the interesting thing is one of the other areas that we saw anxiety manifest a lot, and I think we're still seeing it, and it's coming out in the data as well as in our clinic nationally, is eating disorders.
Mhm.
Um, and there's been a lot of an
Yeah.
increase in eating disorders of various type in terms of both sort of overeating as well as sort of not eating and anorexia
Mhm.
type profiles, that I think we're still trying to figure out. But some of that I think is could be partly anxiety driven. Kids
Mhm.
sort of in the home, not exercising, really grappling with their eating patterns and overeating, gaining weight during the
Mhm.
pandemic,
Mhm.
and then being online and people talking about it. So I think that all of those things contributed to some significant eating disorders, and we're seeing that a
Mhm.
lot more, prevalent and needing care in our services.
So interesting that you mentioned that. We've definitely seen that in our clinic as well, particularly more and more kids coming in with obesity who pre-pandemic had BMIs within maybe a slightly overweight range or
Yeah,
within, what's considered typical range,
yeah,
but significantly gained weight during the pandemic, which, right, as you say, it's so much of it is a structural
hmm,
systemic issue as opposed to individual choices
right,
and all of that. So that's been really difficult. And then the on the what I've been thinking of the other side of the coin, but you
hmm,
make so much sense in that it's actually maybe part of the same spectrum with anxiety, is the eating disorders around anorexia.
yeah,
So thank you for kind of putting that into a framework that I think makes a lot of sense around thinking about these as being related to anxiety. Um,
yeah,
but unfortunately, the pandemic is not the only crisis that the world is experiencing.
yeah,
And we've all seen those images lately or been affected in some way by the war in Ukraine and
yeah,
other global events that are traumatizing to watch. And all
hmm,
too often, we see the news reports of police brutality against
yeah,
Black men and others.
yeah,
And the list of potentially anxiety provoking things goes on, right? So, what are your recommendations to parents about how to approach questions that kids may have about these events
hmm,
without causing more anxiety for your
hmm,
kids? And maybe this
yeah,
depends on age, so kind of what do you suggest to
hmm.
parents?
Yeah, I mean, I definitely think it depends on age. Um, all of those things have been happening concurrently, and also with a lot of sort of focus on climate change too. I would add that into
Mm,
that, and
yes.
climate change
So
related
true.
disasters, which I think is another thing that's floating around quite a bit in terms of increasing anxiety for young people. And I think for the much younger children, when we're talking about toddlers or early age, school age, I think it really have to minimize their exposure. I mean, I think that's the first and foremost prevention piece, right? Of not having
Mhm.
them have sort of such exposure to the media, and television news and all of those other things, because I think it can be very confusing for them to see those
Mhm.
things.
Hmm.
If and if they do see it, I think it's really important to sort of see what questions they have. Right. I always think it's important to see how they're thinking about it or asking about those issues, because sometimes we can give too much information and trying to explain.
Hmm.
Right?
Yeah.
Right. And so if we think they've seen that, what what do you think? Do you have questions about that? And answering them as simply as possible, right? And in not a dishonest way. Like, I think across the age range, it's not saying, no, there's nothing going on there. But being honest that there is something there that's concerning, even to you as a caregiver, as an adult. And what are the things that are in place to try to, protect them from that, right? And how the caregiver can sort of be there for if they're feeling scared or if they're experiencing something around the situation, that they could come and ask questions, and that there are adults around them, right, that are trying to protect them.
Mm.
And that there's always, the preponderance of the situation are good people around you, right? Who are trying to support you, your teachers, myself, right? And we're all aware of how scary this can be. And we're all working together to try to make it okay for you and for other kids. I think that's the message. I think it gets really complicated with the teenagers, right? Because I mean, I have to
Mhm.
be honest. I have a lot of teenagers who are young people of color, and when they're concerned about these issues of racialized violence and immigration issues, right, which is another big thing that I've seen
Mhm.
around sort of concerns about their parents getting deported,
Mhm.
those
Mhm.
are so real, right? And I think that um, definitely the honesty and validation of the truth of the scariness of that,
Mhm.
Right.
and the injustices, and hearing what they're thinking about that and what they're feeling about that, and trying to really work in the ways that they can provide. I try to sort of validate and then offer, like, let's strategize about your self care.
Mm.
What do you think would help you, right? When you're seeing those things on television, how does it feel? Do you think, what do you think about watching that, right? And do you think you need to sort of protect yourself a little bit around that? Because I mean, we know in the data, with young people who even are seeing these things just on the media, that there's some data showing that's increasing the risk for depression, anxiety, and even
That makes
PTSD.
sense, yeah.
Yeah.
Right. Which in the past we thought, well, they're not experiencing it directly, and they may or may not be. I
Mhm.
have kids that are directly experiencing deaths in community. But even just watching that remotely, right, on news or otherwise, we know can be a risk for anxiety and depression. So I talk to kids about sort of their consumption of that media, and what do they think the impact it is for them to look at that, and what can they do around self care, right, in terms of how they're focusing in school, exercise. We if they're experiencing a lot of anxiety, the physical symptoms, we talk about self regulation, and I really present it as not, we're trying to forget that that's not happening, or that's
Mhm.
not happening, but more like that's happening. And a really important thing for us during this time is to have self care, right? And to be able to participate in things that make us feel like we have a community to talk about with these things, or proactive things that we can do to help others or ourselves. We have agency around the areas that we can do things. I mean, and that's how we have felt like, I mean, if you think about even as providers, right, or family members, like I think
Mm.
people felt like a big coping skill was to do something
Mhm.
that could help someone, right? Like either work in a food place where you're giving food for people who have been really harmed financially by the pandemic, or, working as teams to be able to sort of help kids sort of do their homework and things like that when they were like virtually trying to do this. And so I think, and kids can do things too, right? That sort of support others, get them engaged in sort of positive activities, whether it's sports or working with people and helping people. Like I think all of those things can be very helpful and engender more of a spirit of what can I do that's generative, right? What can I
Mhm.
do that's within my control, and who are my support people, and how do I take care of myself in the midst of these things that can seem very uncontrollable.
I think that's so key. I mean, I think that's difficult during the pandemic, but very important for us to keep in mind because, as you said, I mean, a lot of anxiety is being felt in parallel between children and their adult caregivers. So, if there are parents out there who are listening to this episode and are concerned that their child or teenager might be experiencing anxiety, what do you recommend in that situation? Are there small changes that they can make at home to start? And where can they turn if that's not enough and they need some
Right.
help?
Yeah. So I think, we were talking a little bit earlier about the importance of routine and structure,
Mhm.
right? And that was really important during the pandemic when the whole routine was at home. But even now, right, as children, adolescents are going back or are back in school, going back to school, it's still important to have, as much as we can, routines and predictability, right? And also choices, right, that they can have. I think kids who feel a lot of anxiety because they feel out of control of their environment and situations, I think parents can offer things like even sort of, choosing together what you're going to cook, right?
Mm,
Cooking together, having activities that are positive. I think parents can also learn a lot from, mindfulness or other sort of relaxation techniques that parents can learn themselves that we can teach as providers. Or also, there's a lot of resources online, and we can talk about sort of helpful, not helpful online things. But there are
mm,
things, online that are around how do I practice a meditation or mindfulness, and it doesn't have to be hours of meditation, right? It could just be, sort of taking sort of some deep breaths at certain points during the day together, or taking a walk and doing that physical activity, and sort of modeling ways to
mm,
sort of manage our anxious feelings. And then I think the other piece is opening up, always having an open door to be able to talk about when things are anxious. Because sometimes kids feel weird about saying that they feel scared about things
mm,
or anxious. And I think sometimes, in our own anxiety as caregivers, one of the things we might do is either overprotect them and not let
mhm,
them sort of, explore those things with support, but still, do those things and try it out. We try to sort of protect and say, oh, that's too hard. And especially if kids
mhm,
get very dysregulated and anxious, parents may feel scared that they're going to have a heart attack. They're going to like completely collapse doing this thing, right? And sort of how to support, kids and, going to a party and, right here and trying a little bit and not sort of too quickly letting them isolate and avoid
mhm,
the situations. But it can get very complicated, right? Sometimes kids can have very strong anxiety reactions and start really having problems focusing and in sleep. And then I think the first thing is really to talk to their pediatrician because, I think that's really the first person or the family practitioner to really, talk about what they're experiencing and having a screening or an assessment of seeing if there is more of a severe anxiety and the impact. And sometimes there's things that can be done supportively. And I think we're having more and more integrated care models where there
mhm,
are like behavioral health people who are within pediatric practices who can help in developing these anxiety coping skills with children as a first line, because those things can be really helpful. And then if it persists and it really does cause such problems where the child's not playing or going out or being with friends, or they're having problems in school and academics, that's always a big sign, right? Or they're withdrawing from
mhm,
school and others. Then, and the sort of first touch of really, working with a behavioral clinician who is helping them with coping. If that's not working enough, then, consultation and referral for maybe specialty behavioral health care, psychiatrist or psychologist might be indicated.
And so when families do reach out and maybe get referred to a psychologist or a psychiatrist, or a therapist, what kinds of treatments are available? What would a
Mm-hmm.
parent expect as they
Mm-hmm.
walk
Mm-hmm.
into that office?
Mm-hmm. There's a lot. The good news is a lot that we can do with what we call talk therapies,
Mhm,
right? And behavioral therapies. So there's the things that have evidence for children, and actually kind of goes down quite to young children, where the younger children you might do this therapy together with the caregiver, right? And as kids get older, you might do it more with the adolescent by themselves, with maybe some support from others. But cognitive behavioral therapy is something that people might have heard of, which is really a therapy where you work with the individual to think about, sort of examine their thinking and their behaviors and their actions and how those are interrelated. Like, for example, if I'm thinking that something bad is going to really happen, do I notice that then I start getting sweaty and anxious, and then I start withdrawing and I start having other problems of
mhm,
avoiding, and so it gets you to explore, each situation, like, well, why am I thinking that there's going to be a problem here? Is there really that much of a problem, right? And if there is, what can I do around my coping skills, right? To sort of manage that situation and explore it and come closer and avoid a little bit less. And sometimes it also, you have these exposure therapies, right? Where you actually take the anxious things that
Mm,
you have that make you really anxious, and you kind of create a ladder of like the least scary thing to all the way up to the
mhm,
highest scary thing.
Mm.
But the lowest scary thing needs to be a little bit scary so you can try it out,
mhm,
right? And so, so the therapist might have the person try that out. Like maybe it's like, I feel scared to go to the corner store, right? It's not horrible, but I kind of feel anxious, and they might have, well, why don't you try that, right? And use sort of your breathing skills in that, and sort of do that and see, and then come back and let's explore how that was. And then you kind of build up the ladder of this to the scariest thing. But you've had successes all the way up, and you keep experimenting and sort of not avoiding those situations, but managing those situations more and more. And so and it also, these therapies also have a lot of psychoeducation, which is helping the youth learn about what is anxiety and
mm,
what is this that I'm feeling. And sometimes that does a tremendous amount for kids to understand, oh, I see what's happening here, right? And then working with an adult to a therapist to work through those in these ways that I'm talking about. And then also supporting the parent in supporting them in doing that
mhm.
experimentation and building those situations, not helping, not sort of saying, oh no, let's not do it, but actually, helping them come closer to trying
Right.
it out. So those are all things. Those are sort of the primary therapies that we often use for anxiety. And also sort of coping skills are incorporated in that, mindfulness,
Mhm.
breathing, all of those things that can help the physical symptoms of like sort of feeling revved up and anxious. That can help kids a lot right off the bat. And those usually are the first things, how to sort of manage those immediate, like overwhelming feelings.
Mhm.
Medication is there as a possibility, and usually we use that for more severe anxiety that maybe is not responding as much to the therapy. And there's some data that shows that together it might work synergistically and kind of actually improve results. But a lot of kids do really well with the therapy.
That's encouraging.
Yeah.
Yeah.
Absolutely.
And for you talked about this a little bit for parents who are trying to figure out sort of where to turn for help. So you mentioned reaching out maybe to the pediatrician first and getting referrals potentially. For those who are then making the decision around a therapist versus a psychologist versus a psychiatrist, can you maybe briefly kind of break down how one would make that decision, or is there sort of a ladder
Mm-hmm, mm-hmm.
between those three options?
Right. So therapist, psychologist, psychiatrist.
Right.
So, I mean, there's different doors you can come into, right? And it depends on where people practice. I think most of the time, in my opinion, people would probably interact with their pediatrician first, right? And probably would, the first line would probably be referral to a therapist who might be a psychologist or a clinical social worker, right? Who or other mental health professional, right? Who is sort of who is licensed and certified to do therapy, right, with children and adolescents, and those are found in all different kinds of places, in terms of sometimes at the pediatric office or at a separate clinic or private practice. So I think that those would usually be the front line. The other place where that might happen, that referrals in school. And I think that one
Yeah.
of the really great things is the expansion, I think, that's happening hopefully more and more around the
Mhm.
country, is having counselors, therapists that are in schools at
Mm.
health clinics that are embedded in
Yeah.
schools, as well as or just there, because a lot, if you can imagine, there's a lot that can be done if a parent's noticing, and they talk to the school guidance and other people to sort of say, I'm really noticing that my child's experiencing a lot of anxiety. They might be seeing it in the school, and that can be really powerful, because in those instances you could have, as you can imagine, a therapist who's right there, who can support the child or the adolescent through the day if they needed to check in, who can support them in that sort of exposure thing, right? And reinforce
Mhm.
that and support them in that. And work with the teachers on how they might adapt some of the things in the classroom or support the student so that they can be successful in the classroom, right? So that's another place of the school that might be an excellent resource. Psychiatrists, I'm a child and adolescent psychiatrist. I love doing therapy. A lot of times, when you're talking about sort of the latter, I usually get called in later, in terms of, the therapists are,
Mhm.
doing it, and then they want to make a referral for evaluation to see if medication might be indicated because
Mhm.
there's not as strong a response as we would hope with the therapy.
That's so interesting, and I think that's important. If you are not in the medical field, some of these distinctions may not be clear. So I
Mhm.
think that's
Yeah.
really helpful for parents and caregivers. And can we just circle back a little bit? You had mentioned that there can be a role for technology in dealing with a lot of these sort of mental health disorders or symptoms. And can you talk a little bit about how that might be helpful, given that, we've all seen and heard and maybe used some of the apps that are out there that claim to help people manage their stress?
Yeah.
Is there a place for that type of app or any other type of technology for children and adolescents that might be struggling with mental health issues?
Yeah, so I mean that it's a really interesting question. There's more and more technology coming out, that are mental health apps, right? There's even therapies that
Hmm.
are coming out that are, what we call asynchronous therapy. So it's that, therapies that are actually accessible to families where they can, log on and actually work through a CBT, therapy,
Mhm.
on their
Wow.
own, and usually it has a therapist a real life therapist connected in those cases
Mhm.
where families can check in and, they can sort of go through the modules, but also get the support of a
Mhm.
coach, right, who's a therapist to sort of help families work through that. So, the area of psychology is developing more and more of that. But then there's a whole bunch of apps, right, that are coming out, and I think, what parents can do in terms of, I guess, figuring out what is okay and what's right. There are a lot of apps that are just basically, how to do breathing exercises, right,
Mhm.
and sort of slow your breath, right, which those might be really sort of great, tools to use along with, therapy, right, if they're already practicing those breathing things, right, then you can use the app to sort of, there's apps that sort of help you sort of, figure out how to pace your breathing, right, or
Mhm.
how to sort of, do a mindful meditation that's, guided, right, by the app, which can sometimes make it much easier to do those practices than just going into your room and trying to do them yourself,
Mhm.
right. And those practices are good because, what we find, what I always tell young people is you want to sort of practice those things regularly, right? So that mindfulness or that breathing when you're not anxious, right? Just sort of building
Yeah.
that skill set. And what I tell kids is, if you were practicing for a sport, all right, you're not going to start practicing and doing drills in the middle of the game, right? Like you're gonna, or whatever, or you're in a play, you're not going to start practicing your lines then. So it's the same thing with like the anxiety, right? Like you sort of build, this muscle, so to speak, by
Mhm.
having
That
a
makes
regular
sense.
practice. And sometimes the apps help, right? Sort of
Hmm.
keep us, going. I mean, I even think about sort of, my phone, I mean, or my watch, it has a mindful moment where,
Mhm.
it kind of tells me, take these, 3 minutes to just breathe or, so I think those kinds of things can be helpful. As sort of skill building things and tools
Sure.
to be able to do
Yeah.
that.
Thank you so much, Dr. Fortuna. That has been so helpful. I think that all of us who are parents or responsible in some way for young people have seen the impacts of the pandemic and war and all
Mhm.
sorts of other things going on the little people in our care. So we really appreciate you sharing your wisdom and some practical tips that hopefully will be helpful.
Great.
Thank you.
Thank
This was
you.
so great, so helpful.
Thank you for having me here. Thank you.
Thanks so much to Dr. Lisa Fortuna for her expertise and insight in what can be a really difficult topic. Honestly, that was therapeutic. If you want to hear more, please make sure to listen to our episode 36, where we spoke with Dr. Shirin Ali about mental health more broadly during the pandemic. For more resources on this topic and more, visit our show notes at hippocratichost.com. Thank you so much for listening as always. We appreciate you all so much. Don't forget to follow us on Facebook, Instagram, and Twitter. We're also on Pinterest. And if you like what you hear, please do subscribe and review us in Apple Podcasts and tell a friend about the show.
Thanks, everyone. Talk to you soon.
See you soon.
Thanks for listening to Health at Home with the Hippocratic hosts. Remember that all views expressed here are our own, not our employers, and all content is for informational purposes only and should not be construed as medical advice, nor the establishment of a doctor-patient relationship. Always consult your own physician or healthcare team for any medical issues.
If you enjoyed this episode, please rate us, subscribe, and tell a friend. And check out our website at www.hippocratichosts.com for show notes on this and all our episodes. Can't wait to chat with you next time.